Hi, my name is Dr. Lori Givens, and I have a sensitive subject that I want to discuss with you. It may or may not be appropriate if moms think that little children shouldn't understand about their bodies and how they work. So if you have little ones, you might want to shuffle them out of the room for this conversation. I believe that women can be fabulous at any age. Whether you're 26 or 66, I think that all women should feel the way that they want to feel. Over the years, I've had a few frustrations in my medical career. One of them has been the aging process. So as we get older and we have life changes and body changes, everything doesn't work like it used to. And so I've discovered, after doing some research, there are ways that we can correct the changes that childbearing, age, and chronic diseases give our bodies. Things like deliveries, having lots of babies, or even having cancer can change the way your body feels and your level of intimacy that you're able to achieve. And so after doing my research, I discovered a procedure called the Thermiva. The Thermiva is a procedure that is painless, that simply uses heat to heat the tissue of the vagina in order to rejuvenate it or bring it back to what it used to be, or as some of my girlfriends say, snap back. What I'd like for you to know about the procedure, it differs from other procedures in the community. Lasers are heat procedures that can cause pain. The caliber or the width or the girth of the device that's used in order to treat the tissue is a lot wider than the Thermiva device. The Thermiva is about as big as my pinky finger, and the only part that contacts the tissue of the vagina is my fingertip, this part here. And because it's so small, patients who are having problems with narrowing of the vagina, or what we call vaginal stenosis, or vaginal atrophy, or pain, burning, and tenderness of the tissue with age or due to lack of estrogen from cancer or things of that nature, not being able to take estrogen because of breast cancer and things like that, can get relief. It takes usually just 3 treatments over the span of 3 months. Each procedure is 4 to 6 weeks apart, and the first procedure basically wakes up the tissue that you have in place. The second procedure rejuvenates the tissue, so you get new blood flow to the area, you stimulate the nerves in the area, which makes you more sensitive. It also relieves vaginal dryness. And the original purpose of the procedure was to prevent urinary incontinence or leaking urine when you sneeze and cough. So a happy little accident we found is the increase in sensitivity and I'll just put it this way, improved intimacy. After the 3 treatments, usually patients only need to have a touch-up once a year or once every other year in order to keep the end result in place. And so I just really hope that women who are struggling with these issues of vaginal dryness and vaginal atrophy and painful intercourse and urinary incontinence will consider a procedure that not only will change your life, but will change your outlook on life. How much would you give in order to feel the way you felt in your youth, in order to be able to interact with your partner the way you did 10 or 15 years ago, or before the 3 children, or the 3 vaginal deliveries, or before the breast cancer? As a woman, I believe that we have to invest time and energy and effort into making sure that we have the life that we want to have, because as I said before, I'm Dr. Lori Givens. I believe that women can be fabulous at any age.